Finally, we decided to do something about food safety. We don't do it very often. It took us 70 years since we last addressed food safety, and we passed a bipartisan bill last year. President Obama signed it, and it really changed the world of food safety. At least it was designed to. We set out to make some changes that will really reflect today's world. For example, produce safety standards. Could there be a more topical, contemporary, timely issue in this area? We've heard about a dozen or so people who've come down with E. coli in the St. Louis area, several on our side of the river. They're looking now for the source. They haven't really pinpointed it, but it appears to be some fresh fruit and produce that could have generated this illness, E. coli illness, which can be serious and can be deadly. What we've done with this new food safety law is to address that. First, with produce safety standards. The new law requires the FDA to develop and implement commodity-specific, science-based standards for safe growing and harvest of fresh produce. The investigation is still ongoing here as to what the cause is, but the folks that have contacted this foodborne illness, contracted it in E. coli, apparently were victims of fresh fruits and vegetables that weren't properly cleaned. Implementing new produce safety standards will ensure that businesses growing and handling produce do it in a way that ensures folks don't get sick. Secondly, and this is important, enhanced traceback. Once you have an idea about what the source is, how do you get to the product manufacturer or harvester to make certain that others aren't in danger? The new law requires the FDA to develop new rules to enhance the ability to rapidly trace back contaminated food to its source, and it's critical because then state departments of health, like the Illinois Department of Health, can move in and help us. We also have hazard analysis and preventive control plans. In a few words, we get down to the scientific aspect of where we are most vulnerable. We can't watch every minute and every second, but we want to focus on those where there's real vulnerability. At what point in the process is it critically important? As Ms. Brockman can tell you, when it comes to certain things, it's a temperature issue. And the students are learning that, I'm sure, when they're dealing with certain prepared foods. In the others, it's a question of preparing things in a clean fashion and in a clean format and using clean utensils to do it. But we are going to focus in on a scientific basis to identify the areas where we can do the most. Next, and not surprisingly, is increased inspections. We need more cops on the beat. I used to work, now I'm going to date myself a little bit here, but I used to work at Hunter Packing Company in East St. Louis, Illinois. That's how I worked my way through college. The U.S. Department of Agriculture had an inspector on the spot every minute of every day that the plant was open. That was expected. That was a meat plant. And we were dealing with pork products. But when it comes to the Food and Drug Administration, they are fortunate to get in and visit their facilities once every 12 months. Not every day, once every 12 months. So we said we need to put more produce inspectors and meat inspectors and inspectors, food inspectors, through the FDA out as well. And that was part of what we're setting out to do. The last part of what I'm about to say is challenging. Because we passed a good law, bipartisan law, the President signed it. Unfortunately, we're seeing dramatic cutback in the budget for the Food and Drug Administration in this next fiscal year. It's cold comfort to people know that we have a good law in the books if we don't have the people to make it work. And folks who are out there keeping an eye on food so we don't end up being vulnerable. I think we've got to turn this around. We increased the FDA budget on the Senate side. We've got to work with the House now in the conference committee to try to bring adequate funding here. I will just tell you, we are in a budget situation where we can't spend as much as we want, but when it comes to public health and safety, that has to be our highest priority. Talk to the 10 or 12 families that have been touched by this E. coli illness and ask them if this is an area where we need to cut back, and they will tell you, please, spare others from what we are going through with hospitalizations and illnesses that come from those who violate the foodborne safety standards.